So I'm Martin Edlund. I'm the CEO of the Health Finance Coalition, and Mallory No More, who is the founder and host of Forecasting Healthy Futures. So just want to add my thanks to everyone in the FHF community for making this such an impactful summit. Let's also give a big hand to Kelly Willis and to the FHF team, to Sam and the production team. It's not easy to put on a hybrid summit, virtual and in person. This has been months, one might say years in the making, so let's give them a big hand. I also want to add my thanks to our sponsors, without whom we couldn't put on this event. Thank you to Takeda, Oxitec, and Pathfinder. Thanks also to Dodo, who you heard from to start the day, to Dinesh and the ADB team for co-hosting this critical third day on climate financing. Now, we've heard so much about innovations in day one, including the submissions that came through the FHF Resilient Futures Award, innovations to address mosquito-borne disease, heat stress, biodiversity, nature-based solutions, water, food security, and so many other areas that are impacted by climate change. On day two, we heard from Agnes Suarez da Silva about the ambitions that Brazil has to drive an action plan for adaptation for the health sector as we build toward COP30 here in Brazil. We also heard yesterday from advocates and youth to describe the movements that are building to put health at the center of climate action. I'd humbly submit that none of these brilliant ideas or passionate calls to action will be realized without financing. Without adequate financing, without appropriate financing, the right instruments to meet country needs, and without aligned financing that fits the priorities and needs of the countries most impacted by climate change. So this panel, the first of our Geek Out sessions on financing, is called Aligned Investments for Optimized Impact. Now, we at the Health Finance Coalition have been deeply engaged in the financing conversations around climate and health over the last number of years. And I can say with confidence that we do not yet have aligned financing for optimized impact. But we're seeing some bold commitments from financing institutions, as we'll hear about on this panel. We're also seeing clear demand and guidance from countries that can help us get there. So we have a fantastic group of panelists to explore this topic today. We are committed to making financing fun. And so that's my challenge to our panelists. Let's make financing fun. So let me introduce them briefly, and then we'll get into the discussion. So I'm, of course, joined on stage by Dinesh Arora, who's Principal Health Specialist at the Asian Development Bank, where he oversees health sector operations and climate resilience strategy. I also want to thank Dinesh and the ADB for bringing country stakeholders from Pakistan, the Philippines, and India to the FHF Summit. It's been fantastic to engage with you, and we'll be hearing from some of those country partners later today. Our second panelist is Prashant Poondla, who's Associate Director of SEEK Development. He leads cross-donor investment strategy work at SEEK, including a recent analysis that they led on the state of climate health financing. So that'll be good ground setting for the conversation that we'll have today. We're joined by Marionka Pohl, who is Global Head of Health Policy and Advocacy at Save the Children International, where she oversees global health policy engagement, bringing advocacy with program delivery and financing strategies. And finally, we're joined by Tamer Rabie, who's the Global Program Lead for Climate and Health at the World Bank, where he leads the bank's climate and health portfolio, including the 2024 Multilateral Working Group on Harmonized MDB investment strategies that was co-led between the World Bank and the ADB. For those who have attended past summits, Tamer will be a familiar face. I think he's been at both of our past summits, so Tamer, sorry you couldn't be in Rio with us in person today. So Prashant, I want to start with you. As I mentioned in the intro, on behalf of a group of philanthropies, you and SEEK led an analysis of the state of climate and health financing. We've talked all week about the massive pressures, the mounting pressures, and the costs that countries face from climate-related health impacts. A recent World Bank analysis estimated losses for low and middle income countries at $21 trillion by 2050. And of course, we know that wealthy countries committed at COP29 to triple the annual commitment to LMICs from 100 billion per year to 300 billion per year. So Prashant, you led this analysis. You interviewed and spoke to and so many partners and analyzed the data. What did you learn? Where are we seeing upward trajectories in financing? Where do you have cause for concern and see money flatlining or even declining? Prashant.
Thank you. Sorry I couldn't be there in person, but have been listening to some of the conversations the last couple of days. Hopefully you can hear me well.
We can.
So maybe I'll focus. I won't talk through the report, and I'm sure it can be shared. There's quite a lot in it, but maybe the key takeaways to connect to, I think, what the others are going to speak to. So, I mean, the fact of the matter is that, there's been some work and studies on how much funding we need, and there's quite a lot of pressure, so to speak, on the funding. That's true. Compared to that, funding is quite limited. We saw or tracked about $7 billion of funding in 2022. While some funders have grown their funding over the couple of years since then, it's almost certain that that funding is actually lower by about 20 to 30% as if we were to look at it today. We can't yet see that because the data is a bit delayed, but that's the direction it's going in. So overall, there is more attention and interest than the funding that's actually showing up. If you look at how that funding is being spent and where, as of today, or 2 years ago, this group would probably call the funding quality relatively poor. A lot of that funding is not explicitly focused on climate change impacts, but rather what you would call climate-sensitive interventions. If I were to put it very crudely, it's the equivalent of slapping a solar panel on a hospital and calling that climate and health investments. This is not the case for everything, so about 30 to 40% of the funding of that $7 billion is of this kind. And I think that, what we learned from everybody was that there's a lot of work that's going on to kind of line up the right approaches, the indicators. The pipelines are catching up, so one can hope and one should see that the funding is being much better spent and better targeted in the near future. Also, along with guidance from countries themselves on what they need and where they want to direct that funding. If you think about patterns of what are the areas that are being funded, past funding in line with this sort of, let's say, not yet at the quality we would like to see, it's quite aligned to how overall funding for health looks. So there's quite a lot of investments in infectious disease control. A lot of funding is going to infrastructure investments. We're seeing increasing investment in emerging impacts like heat illnesses or respiratory illness and emergency preparedness, and quite a lot of work in the last couple of years in both looking at advanced warning systems, how to build climate services into health, and basically being able to better react to climate impacts. So that's where the funding is moving towards. If we were to jump ahead and say what's going to happen in the future, it'll come as no surprise to this room that ODA funding is going to contract. That was the big powerhouse of funding in the past, almost 70% of all the funding in the past. The growth will likely come in absolute terms from the multilateral development banks, and I'm sure Dinesh and Tamer will speak to that and what they're doing there, and also philanthropies in unlocking funding. This has some implications for this group. I think there's something for advocates, implementers, and countries to think about how to incorporate climate action into health programs and interventions that are already being planned. The second is to pay particular attention to adaptation interventions. What we heard from funders was that these are the ones that are more complex to fund. The pipelines are not quite there. Depending on the kind of investments you have, typically if it's more concessional investments, they're not as investable in those, to put it in their terms. And so something around how we enable programmers, countries, and organizations that are actually on the ground in accessing this kind of funding from institutional funders. So that's probably where you would want to pay more attention. The good news is that a lot of work has happened in the last year and in the conversations in the last couple of days about how to get to these interventions, what are the high impact ones and how to support them. And so we should see more. I'll leave you with one last comment. There's been a lot of talk in this group also about how the real health impacts happen not in the health systems, but somewhat upstream in other sectors where, let's say in transport or energy or wash interventions that actually then lead to better human health. We found that there's quite a lot of funding there that's going to projects that almost twice the funding that's in health systems itself. So about $13 billion of funding in sectors like transport, energy infrastructure, and water interventions that then will have an impact on respiratory health and heat illnesses or emergency preparedness. And there's a need to get to more evidence of what works, how would programs look different to maximize health impact, and to support health leaders in actually engaging with those interventions and projects to make sure that we're getting the health impact we want. And that brings me to, I guess, the topic that you all will speak to soon, which is shared indicators and frameworks. These are obviously critical so that donors know what to fund, countries know what there is funding for, and how to develop for all of us the kind of pipeline or the right interventions to invest in. And also will make sure that we start to invest in the more transformative interventions that do address the impacts of climate and health more front and center. I won't go into what's going on there, but I think the main things to look at are how do philanthropies and some of the other funders actually support this movement and coming together of frameworks and approaches to investment, so that there's sort of shared investment as opposed to complementary or coordinated investments. There's a lot of willingness for this, and there's a couple of coalitions that formed in the last year, apart from the stellar work that the multilateral development banks are doing. And also platforms like Attach have a key role to play in informing this process so that it is aligned to needs and focuses on what's needed in the future. I'll stop there. I'm sure there's more we'll speak to again later. Back to you, Martin.
Thanks so much, Prashant. And for anyone who hasn't seen the report, I'd recommend reading it. There are lots of great insights there. Prashant touched on a number of the themes that we all have to be thinking about if we want to get to aligned financing moving forward. Over the last 25 years, so many of the gains we've seen in global health, including against climate-sensitive disease like malaria, which I've worked on for the last 20 years, has come from ODA, has come in the form of free money, grants to countries to pursue these programs. And the reality is that era is ending. And ending pretty abruptly with the changes that we're seeing in donor countries. Of course, the disruptions in the US are very familiar to everyone here, but the UK has also decreased its ODA spending on global health. And that puts much more emphasis and onus on multilateral development banks, on philanthropies to be that catalytic funding that's needed, on countries to really guide donors about how and where money should be spent. And so it's a great setup for talking with two of the leading multilateral development banks that are with us here today. Tamer, we'll start with you. As I mentioned in the intro, you and Dinesh and your institutions did a lot of work to convene 14 multilateral development banks and a number of national development banks, including BNDES here in Brazil, to think about what does it mean to invest in climate and health? How do we define priorities and investment strategy? How do we develop a framework for accounting for what portion of spending is on health versus climate and health versus climate? From that work, it became really clear that funders need to better coordinate their engagement, their risk assessment, and of course, their financing efforts at a country level. So we've seen really encouraging efforts by the World Bank, the Asian Development Bank, the Green Climate Fund, the Global Fund, to create overlapping MOUs and commitments from the top of your respective institutions to co-invest. But we've also seen that the devil's in the details. That each institution has its own instruments, its own policies, its own targets, its own investment criteria that dictate what monies actually get approved, what projects are supported. So Tamer, can you talk a bit about how financing from the World Bank aligns, complements, or even competes with funding from other sources? And what are some of the early examples of coordination? And if we're not there yet, what do you think it's going to take to truly sync efforts and meet those clear signals of demand from countries? Tamer.
Excellent. Thank you very much, Martin, and thanks to the BFHF team for the invitation to join this panel today. I also want to thank the Brazilian government for hosting us earlier last month, to discuss the Belém Health Action Plan, and obviously hosting us today as well for this event. So I want to start off at the beginning by just reiterating the huge cost of inaction before even talking about, how do we coordinate and what is being done, to coordinate efforts. And I think you've said that in your introduction, Martin, and it was very clear that, under a business as usual scenario, we are looking at a world that's going to bear the economic impact of nearly $21 trillion. And that those that will bear the largest, if you will, a part of that impact are in fact those that have contributed the least to the problem. Countries in sub-Saharan Africa and countries in South Asia. And that's going to be eating up quite a bit of their overall economic prospects moving into the 2030s, 2050s, and even by the end of the century. So shifting now to the question around the alignment, the way that we've been looking at this is that World Bank funding is in the first instance aligned to country needs and priorities. This is about really trying to ensure that we're adopting a country-based operating model, and that this particular model that I'm referring to is in fact syncing. It's a syncing of funds process for the benefits of countries, enabling co-investments as well as coordinated investments. I think Prashant, mentioned, that obviously there's a lot of importance that we need to put in thinking about shared investments, and what I'm referring to here is co-investments. And this is definitely, as Prashant is saying, the way to go. However, having said that, I'm not sure that this is the only way to go. So while we may not be able necessarily to be coming in co-financing arrangements all the time, we can ensure definitely that investments are coordinated at a country level and that they address country priorities. So I'm going to give 3 examples of what I believe are sort of different models of how we can think about financing. The first example is one that you've heard me speak about, quite a number of times. And the reason I bring it up, on several occasions is because it's a fine example of how 4 multilateral development banks came together. It's an example of a co-financing investment. This is where the World Bank, together with the Asian Development Bank, happy to see Dinesh also on the panel, together with the Asian Infrastructure Investment Bank and the Islamic Development Bank came together to support a large health system investment project in Indonesia that came in really focused on strengthening primary care, hospitals, and laboratories. Now, with a combined portfolio of $4 billion, half of which actually went towards climate investments that were much beyond and I'm using, Prashant's examples because obviously the Seek Development report that came out really shed a lot of light on how we look at investments and what is classified as a climate and health investment. And he's absolutely right that this is not just about, putting a solar panel on a healthcare facility and then calling it a major climate investment. In this particular case in Indonesia, I think it went well beyond that. And in fact, the $4 billion and the half of which, went towards climate investments were quite substantial in really thinking about the systems and what we put in place to be able to make them more climate resilient and climate adaptive. I have to also say that in this particular example in Indonesia, we also worked very closely with our sister organization, the IFC, to leverage private sector investments, for climate and health, where the focus in this particular case was on energy efficiency. So that's one example of how we think about, a co-financing investment. The second example that I'd like to bring into this discussion is Bangladesh. And the reason I'm using this is because this is an example of a coordinated investment. And this is where, together with the Asian Development Bank, both of us have supported the government of Bangladesh to really scale up its ambitions to define the country's, if you will, new health sector reform program, aligned obviously with the program that the country itself has put in place, with significant climate adaptation co-benefits in this particular case. And with ADB, and Dinesh obviously can speak even further, to this, what we've done is we've aligned project design and investments, including the what we refer to as disbursement linked indicators, which each of our institutions have used in different country divisions to really align, if you will, on the approach that we use to be able to address country priorities. The last example I want to leave you with is another kind of coordinated investment, where in fact it even could be a co-financing investment that goes well beyond development banks. And this is Nigeria, where we have a sector-wide approach that brings in a number of different funders, not just development banks. So while the World Bank is involved in this, we also have grants that are being provided by the FCDO and by CIF, and also from the Global Financing Facility. And this came in really to showcase, if you will, how we can operate at a country level, addressing the common challenge that the country is seeing. This is in this particular example, focusing on primary healthcare, and how is it that we together can put a programmatic approach of dealing with a huge challenge in a country like as big as Nigeria. So the World Bank brought in $570 million under the HOPE PHC operations, but definitely with a lot of contributions from others. But let me end on the second part of your question, because I think it's an extremely important one. What will it take to truly sink funding for the benefit of countries? And I think that you were spot on, Martin. You said that the devil is in the details. I think that ultimately this is about all partners really coming together, working to better align instruments and policies. This is about how we can ensure that our instruments and policies can bring more synergistic and coordinated financing at a country level to reduce the burden, obviously, on countries. And I'm just going to very quickly give two ways that we've been adopting in the World Bank, and it seems like today I'm talking, quite extensively of the collaboration that we've been having with ADB, and Dinesh again can speak more to that. But I just want to be able to highlight one particular and the first of its kind, in my view, arrangement that we put together with the Asian Development Bank. And I'm here referring to the Full Mutual Reliance Framework. This is a framework that we signed in February earlier this year to deepen our collaboration and co-financing with ADB. And I'm saying it's the first of its kind between any multilateral development banks, because together what we have committed to is streamlining our project processing and implementation. This is a fine example of how you do coordination, starting really from even project inception, thinking about the design of the project, going into the implementation and, the preparation, appraisal, supervision, and obviously completion and evaluation of those projects. And what this particular framework is providing to countries, and again, it's a country-based model, is that under this framework, borrowers from World Bank and ADB co-financed operations, they can now rely on only one set of rules, using either the policies from the World Bank or from ADB, policies and procedures. And this obviously simplifies the process. It ensures that we come together in a truly co-financing partnership that really, sort of breaks down these institutional silos, if you will, from that perspective. And the second example that I want to leave you with is what we had developed in the lead up to the spring meetings last year. This was the Global Collaborative Co-Financing Platform. It was launched by 10 multilateral development banks, and it included a co-financing portal, which is a secure database where co-financiers can share and access information on projects and can see, seeking or benefiting, from obviously co-financing. The reason I'm bringing this up is because through this co-financing platform, we've been able to enhance communication and coordination about prospective, if you will, projects very early in their development. This is to improve, obviously, efficiency and the efforts to facilitate the identification of synergies and opportunities for co-financing. Now, what I want to be able to say on this one is that this is not just about development banks. Again, this global collaborative co-financing platform is open to all financiers. And in fact, what we've seen is that the Agence Française de Développement and the German KfW have also been using this co-financing platform to coordinate their financing efforts with the World Bank as well as with other multilateral development banks and other financiers. I'll stop there. Back to you, Martin.
Thanks, Tamer. So many great examples and specific examples. And if that whetted your appetite for some of these country case studies, we're going to dive deep on the Indonesia example, more than $4 billion that Tamer mentioned. We also will have a deep dive into the Nigeria example that he described. So much more to come there. Dinesh, want to turn to you next. Of course, the IPCC has identified Asia and the Pacific as perhaps the most vulnerable region to climate change. We just heard about examples of financing in Indonesia and Bangladesh. ADB is playing a leading role on climate financing. You've put an ambitious plan together for expanding your support to countries in the region. Can you preview some of ADB's key initiatives? And what are the opportunities that you see as you expand your efforts to better coordinate and leverage partnerships like those in the meeting today, but also partners like the Green Climate Fund, the Global Fund, and others?
Thanks, Martin. I'm audible? Yeah, thanks. I think, Tamer, we should also next time coordinate the points to be spoken, because if you speak first, I have less to speak then. So many common points we have together when we work. But thank you. Thanks, Prashant, for the initial comments. Martin said financing should be fun, right? For me, financing is secondary. Most important is idea, the knowledge which comes through. And when we work, and Tamer will agree, we are country-derived banks. We want countries to come and say, hey, we want this, we want this. We don't have any pre-claimed agenda that, oh, this country should have an adaptation measure, this should have a mitigation measure. This is how we work. And that's our philosophy for most of the banks. So for me, one of the most important element in this whole discussion is a country. And, people may, Prashant, you may see that perhaps financing has not flown much. But remember, there lots of efforts have gone, and now we are in a stage where actually we are in an inception of project typologies is happening. What do you require to do a financing? Money will follow a great idea, I can tell you that. That's how the private sector works. How do the startups become multimillionaire? Why do some of the startups get bought up by those who are working in the space? Because that idea was fantastic. And that's where the power lies. If you have an idea, go to a one country, two country which champions it, takes this, and then the advocacy follows. I think that's the blueprint which I am seeing. Now for climate and health, for a long time it has been a lot of abstract things. We have a Pakistan representative director sitting, and when I met her at Nagasaki, she was saying, I'm not convinced about what adaptation measures are happening within the health department. And yesterday, she was telling us that, hey, how do we go about Wolbachia? How do we implement that? The plan here is sensitization, share information as we move forward. And this has to be combined. Now, we have signed a mutual agreement where we will write, like ADB and the World Bank, will write over each other's processes to have low transaction cost. I think next time when we meet Tamer, we should be joint missions with us. I do keep on hearing when we do something on clay, when the World Bank was not perhaps informed, invited, and that's our fault, because sometimes it doesn't happen at the ground level. While you and me are coordinating at the MDB's level, at the MDB forum, which is a great forum, I think this has to go much more deeper and organic. I'm talking here only about MDBs. But let me take you something on the background, what ADB was thinking. So when we approached countries, one of the leading countries who's our donor said, what do you mean by climate and health? Do you think we should leave primary health care and say we are going to support climate and health? So climate and health is not a vacuum. It's the climate lens for every health investment we make is the point we need to drive. As countries are moving towards a universal health care, we do not want them to conduct the same mistakes which have been done earlier or as the technology arrives. The second point I want to drill is we artificially create difference between adaptation and mitigation. One measure can have more adaptive value and less mitigative value, but both are, for me, two sides of the coin. For example, if you are going for a renewable energy, say rooftop solar for a public health facility, don't you need that public health facility also needs to be resilient to withstand, say, a cyclone or a flood? So if you are going to do that, that's an adaptation measure. So adaptation and mitigation need to come side by side along with the work. So when we were talking to countries about climate and health, we wanted to go more concrete and we went downstream of what attached us. So we came up with those 5-level principles and the countries did ask us, what do you mean when you say adaptation? So we say, as I said, resilient infrastructure. How can we have your infrastructure more resilient? We can come with a gold standards LED technology, which actually helps us in defining that this building is earthquake prone, this building is cyclone prone, or a flood prone and resistant to it. So for me, resilience is two R's. Resistance to any shock. But if the shock happens, responsive to that shock. How can you come back? How do you recoil back to your normalcy is the strength of that. So this will include aware or what we call as advanced warning systems or early warning systems. This will include your adaptation of digital systems. This will include your training of human resources. That if suppose in this rainy season it has to be dengue, what is the guidance they need to give to the community and how do you get community overboard? That's adaptation. The second principle is on resilience. Where I talk about the 3 common things which are being done, the electrification of ambulances, electrification of buildings and energy efficiency. How do we go deeper in that? How do we make circular economy as part of the life? How do we have green bio-waste management? And that's other principles coming out. So the specific examples where countries can work together with MDBs and other partners. Of course, the third is a supply chain because that is the major source of carbon which comes across. Yep. And how do you have those vaccines, therapeutics and diagnostic supply chains not only non-mitigating but also resilient, and can those shock? What happened in COVID is everybody knows, right? Even the basic things were not available. And of course, the 2 other enabling principles are financing, which is the session here, and the One Health, Zoonosis, and Center for Disease Controls. So this bucket is nothing new. The 5 principles are just when we talk to Rui from Philippines, talk to Marine from India, or talk to Vanna from Nigeria, which she's giving an example. We try to just bucket them for easy understanding. I think no solution is a good solution unless it is simplistic and can be understood. Now for these solutions to come, Tamer and I are more of a financial organizations. Our job is, I think Vanna, what you were telling me yesterday, is to take these innovations to scale. But perhaps it's too much to say that we are going to bring those innovations. We can incubate an innovation, but we'll need partners for it. And partners like you, partners like Stop TB, partners like Healthcare Without Harm, actually, which are working with us on these 5-level principles, partners like Unitates, which are coming up with what supply chain mitigation and adaptation measures are required for us to follow. So Prashant, right now, we are at a cusp where we are putting up project typologies. And I'll give you one example. We did a conclave with India in last year, October, September, and came up with project typologies which are bankable, which we typically call as no regret solutions, and move forward. And this is where we are. We are coming up with an outcome report which should be in public domain very soon. Very comprehensive, 7 or 8 solutions which they want ADB to support both at the level of center and at the state level. And I think it's a good point where I think the World Bank and the philanthropists should come together. At the end of the day, whether concessional, non-concessional, MDBs are debt for a country, right? We need to find a new mechanism. Gone are the days of, where the grant financing is going to increase. We, I think, need to be more judicious, build up this grant financing with the concessional financing which MDBs bring, come up with a new model, work together and go to a country and tell this is possible. Now I see, Prashant, more appetite in countries to accept what is required. I think, and we need to keep on learning. Last 2 days has been very much educative for me when I learned about the dengue control being done in Brazil through Vobakia. And I was impressed that Indonesia is going forward. My colleague from Philippines has not slept for last 2 nights. He's asking me, when are we coming and sensitizing their minister there to talk about this? So a knowledge idea picked up by a community together, and we will help you to take that to a scale. I think that's a coordination effort for me. Thank you.
Terrific. Thanks so much, Dinesh. So many great points to pick up on. A phrase that I've started using is we can't stretch aid dollars any further. We need to multiply aid dollars. And the way to do that is to make concessional financing from MDBs even more concessional. And then, of course, to make sure we're backing the right projects and aligning to country priorities. So, Marionka, thank you for your patience. Coming to you to talk about the all-important country perspective. As we just heard from Dinesh, the most important thing is the country, the engagement with the country and their priorities. We also heard that money follows great ideas. In your work at Save the Children, you've been a first mover in supporting countries to develop risk assessments, to capture their priorities in nationally determined contributions, and even to support countries. We've been talking about dengue innovations. I know that SAVE is supporting Burkina Faso to develop and implement Wolbachia solutions as an example. We've heard about the funding landscape. We've just heard from 2 of the key funders. Please give us the country perspective. What clarity and support do countries need to define their risks, to access funding for the solutions that they want to grow? And now's your opportunity. You have these funders as a captive audience. What do you want to say to them on behalf of partners like yourself and countries about how they meet those country needs?
Thank you very much, Martin, first of all, and thank you for inviting me and Save the Children to contribute to this important session. And yes, at Save the Children, we've been working and we are working closely with governments to make sure children's health, specifically as a child rights organization, is prioritized in climate planning and financing, and rather than treated as an afterthought. And you mentioned Burkina Faso. Here we supported the government in developing and costing a national plan to combat climate-sensitive diseases like dengue, which are obviously rising due to extreme heat and flooding. And it's a clear example of how countries can actually move from broad vulnerability assessments to specific fundable interventions that protect lives. And I think most of you also know about our work in Laos. We helped secure the first health-focused green climate fund project globally, which is aligned with the National Health National Adaptation Plan. And this project really supports 100 health facilities, 250 communities, and reaches 2.3 million people. And that is more than 25% of the population. I think quite a stark number. The project strengthens early warning systems, plant resilient infrastructure, WASH, health worker training, and community resilience action plans. But we're also seeing growing demands from governments to include children's health in nationally determined contributions, NDCs. And obviously this year is especially quite a critical topic for all of us to advocate on. But what we hear is also they need support to do so in ways that are evidence-based, aligned with financing pathways, and embedded in national priorities. And from the countries we work with, and I can only speak on behalf of colleagues in those country offices, 3 core asks on their needs and access funding come through clearly. That is clarity, that is coherence, and that is capacity. Countries need clearer guidance on what climate health investments are eligible and how health fits within broader climate finance. Between 2009 and 2019, only 0.5% of adaptation funding from major multilateral climate funds went to health projects. That's less than 150 million USD per year, while the estimated annual health adaptation costs exceeds 11 billion USD. per year. And we know partners like GCF are actively working to bridge that gap, obviously. Ministries of health, and that's what we're also hearing, are often overwhelmed trying to navigate fragmented funding streams, each with different risk appetites, time horizons, monitoring and reporting requirements. That can be quite lengthy. We need better funder coordination to streamline processes and reduce transaction costs for already stretched country teams. On top of that, many countries need technical and institutional support to translate climate-sensitive health vulnerabilities into investment-ready plans. And this includes integrating climate data, health information systems, and risk mapping tools. Our GCF project, for instance, in Laos is a model for this kind of capacity strengthening, incorporating climate and health metrics in routine systems and supporting climate-informed health governance at all levels. And without this kind of support, many vulnerable countries simply won't be able to access or effectively use climate health funding, and leaving many children at risk, which is obviously our main concern at Save the Children. And regarding your question, how climate health funders can help us and our country partners most, I want to flag that this is obviously a moment of opportunity, and it's never been more urgent to act. Funders can play a transformative role by doing three things. First of all, this is about embedding flexibility, equity, and child health into funding criteria. Children account for over 88% of the disease burden linked to climate change, especially those under 5. I think this is also stark. Yet most climate health funding isn't age disaggregated or equity focused. Let's fix that. Funders can prioritize child and gender responsive and equity centered approaches across funding pipelines. Secondly, support country-led joint planning processes. And here again, let me cite the GCF project in Laos, which is really strong. This is built in partnership with the WHO and the Ministry of Health, aligned with national plans and fully embedded in government systems. And this kind of joint planning not only strengthens a country ownership, but it also enhances sustainability and impact. And thirdly and lastly, fund long-term systems change, not just short-term projects. Investments in health workforce resilience, early warning systems, and climate-informed decision-making offer massive returns. And the cost of inaction, I think we all know that, is too high. Climate change could push an additional 132 million people into extreme poverty by 2030, worsening health outcomes for children, most of all. And let me finish with saying that we need more financing that's predictable, accessible, and geared toward long-term resilience and not just quick fixes. But I think we're all on the same page on that. Thank you very much for listening. I'm looking forward to the discussion.
Marionka, thanks so much. It's such an important counterpoint to the discussion we have about global level financing and the work of institutions. And it was clear from the examples you gave, the points you made, that this is a moment of opportunity for financing institutions. We've been working closely with the ADB over the last number of months, talking with countries and hearing clear need and demand. We're doing a little bit of negotiating on the stage. I'm going to ask Dinesh to preview some of the future commitments that the ADB is working toward.
Thanks, Martin. Thank you, Martin. I think I'll just give a preview because there is going to be something very exciting coming up, and that's in the Inspire workshop. I think Dodo mentioned in the initial remarks. So what we have been doing is Southeast Asia has been a geographical boom of a lot of vector-borne diseases. Whether it's tuberculosis, it's dengue, malaria, Zika, chikungunya, we have faced that. So I think we actually were working on how do we intervene in this. Now, we did not want to go for a vertical program, which were earlier like, only malaria or only TB, which has pros because they keep the technical fit, but at the managerial level perhaps become a little resource inefficient. So we thought we should have a health system approach. This is where we came for an approach called EXCITED, Ending Climate Vulnerable Infectious Tropical Diseases. What we are trying to say is, hey countries, Marine, we are coming to you. How do we eliminate dengue right now rather than waiting for 5 years, business as usual, and then spending twice the cost in doing this? Marine will tell me, hey Dinesh, where are your numbers? Get me your numbers. I look at Martin and say, Martin, where are the numbers? This is a partnership of a country, a bank, a technical organization coming together with philanthropy. I'll need Vandana to go and convince for other countries also, Vandana, that how dengue needs to be controlled. Indonesia also needs to do the same as Philippines, as India, as Bangladesh. And this is where we will need to do a customized story. And this is an approach, what we call as ending climate vulnerable infectious tropical diseases. ADB is planning a $2 billion investment linked with some philanthropic trust funds and a technical assistance. Technical assistance is right now going on. We plan to come up with about a 5 million technical assistance this year for some pilot implementation ideas, missions, and discussion. But then the idea here is to move forward jointly to end this dengue, malaria, TB, and other vector-borne diseases and come up with a sustainable model for a country, nudge them into action, and perhaps move towards elimination. It's a small preview, but I think I will request everyone here, please watch out for the space. My co-panelist and Martin will be there in Inspire from 7 to 11 July in Manila, and we will be discussing different country models also along with Excited.
You heard it here first. A round of applause for the ADB and a preview of their Excited initiative.
Thank you.
So I think we have 8 minutes left, according to my clock.
I think that was in lieu of the
That was
clap.
I see. Okay. That's how the room claps. So we've often heard that we tend to overestimate what we can get done in a year and underestimate what we can get done in 5 years. So I want to open this question up to the group, and please keep your answers short. I'd like to get through a few questions if we can. But where do you think we can be by COP30 in Belém when we all reconvene here in Brazil? And where do we need to be in 5 years? And what are the critical priorities to get us to that 5-year goal? Prashant, let's start with you.
Thanks. I think by Belém, we should have gotten past the way of discussing shared frameworks and what they look like to having something out there that others can pattern on, other funders. If I think about 5 years from now, maybe slightly controversial, but all health action should be climate and health action. I mean, how we see that is some kind of deeper integration than, these words are coming together, but at some point we should be past that end together. I will leave it to the experts to think about what that looks like. Over.
Thanks, Prashant. Tamer?
Yeah, by Belém, and I guess, I said it also while I was in Brasilia last month. This is the solutions COP. This is the adaptation COP. This has to be a COP where we come together really to focus our attention on what are the most cost-effective or the highest value interventions that we can bring to scale. So this is actually defining the space. And in this regard, I just want to be able to say that, at the World Bank, we've been leading a global effort to identify the best buys for health system adaptation. And we will be presenting that at COP30 in Belém. And I believe that this is going to help us all really define how to scale up and what to scale up, including obviously what our colleague Marionka was also speaking about in terms of the gender disaggregation as well as the age disaggregation as well. Moving beyond, Belém and thinking about, next 5 years, I believe this, the next 5 years, this is about really the success stories that we need to talk about, the transformational changes that we can bring, forward. The impacts of this, the Excited, for example, program that the ADB is talking about, but others as well that can be brought, the Nigerias, the Indonesias, so on and so forth. So rather than focusing on design of projects and programs, really focusing on results and what is it that we can see from that. So I see two main things coming from this. One is ensuring that obviously at that point we can get Prashant to talk a little bit more about how financing has been moving up and moving in the right direction and have a sort of a second round of a Seek development report, that shows this. And then two, together with the Lancet Countdown and the efforts that they've been leading, really showcase the joint metrics to be able to measure success in terms of lives saved, number of people that are pulled out of poverty. And I'm very happy that Marionka was referring to the work that we did in the World Bank on those that would be pushed into extreme poverty by 2030. So let's see how many we can actually get out or curb from falling into poverty. And then the last point, obviously, is how much carbon emissions we've been able to reduce as well.
Terrific. Thanks, Tamer. Marionka, over to you. 1 year, 5 years.
Yeah, thank you, Martin. I think by COP30, and this is pretty ambitious, we should see a critical shift in regards to the development of national adaptation plans. I think climate health should be integrated into every national adaptation plan. And obviously that needs to be backed by coordinated financing frameworks that prioritize equity and child health for us. And in 5 years, I think climate finance should routinely support frontline health systems, and that includes wash infrastructure to workforce training, and especially in high-risk and underfunded settings. And getting there, we really take joint investment pipelines, simplified access, and country-driven leadership at the core of all planning. And I'm really excited to see this is actually happening across sectors, the discussions how to further that in this virtual space already. Thank you.
Dinesh, 1 year, 5 years.
1 year alignment and realignment. The way the financing is drying down on grants, we will need to come up with a new model, and I think we'll need to put our heads together. COP will be a great occasion for alignment of these minds. And I again say it's countries, MDBs, technical organizations, NGOs, all coming together. That's for 1 year. For 5 years, I think in this room, we will not have only people from health. We will have from transport, we will have from wash, we will have from sanitation. Prashant, there will be lots of projects with health. Then you will be next time telling us, hey, concentrate on multi-sectoral projects. It's more judicious. I think that's where we are moving towards in the next 5 years. I'm very optimistic. The momentum on climate and health is here. Irrespective of what's happening geopolitically, new ideas are coming and they are going to be there. Thank you.
I think we have time for one more question. So, we've talked about the capabilities of the multilateral development banks. We've talked about the work they're doing together, including really harmonizing and simplifying for countries their ability to access funding. But we do need that catalytic capital, that grant capital, to make this affordable for countries, to make it sustainable. We have two critical partners in that regard in the Global Fund to fight AIDS, TB, and malaria, and the Green Climate Fund, respectively the largest multilateral financiers of health and climate adaptation work. The Global Fund, of course, is here with us, and you've heard from Peter Sands and from Seoul yesterday. The Green Climate Fund we're all working very closely with. Lightning round, what's an example of how you're working with those grant providers already, or what would be the opportunity you see to work with them as we begin to forge this new model? We'll go in the same order. Prashant.
I think the thing I was going to say they have already done, which is, I think, a bit of a coming together of all of the incredible amounts of money the GCF is planning to spend on sort of country preparedness and planning and pipelines, with a view to very explicitly getting funding from other funders, such as the Global Fund, not just the GCF's own needs. Like, it's a, let's say, dual-use way of using that money. Over.
Tamer?
Yeah, so we've already signed an MOU with the Global Fund, in the lead up to COP28, and we've been working very closely with the Global Fund and actually identifying specific countries of support. And in fact, our latest discussion took place this morning, just before this session. And we have identified a number of countries where we're working on shared co-investments within those countries, and also technical assistance programs. Those will be being rolled out very soon, perhaps in the next month or two. So I believe there's already a lot of coordinated efforts happening under that MOU. GCF, I believe that, we're very much a strong partner with GCF. And there's been discussions that you also know of, Martin, quite, closely in terms of how we align our investment frameworks with GCF, with Rockefeller, as well as with the Global Fund. And in this particular case, using their readiness and preparatory support funding program would be obviously very important. We're taking this into the discussions. How can we support the building of investment cases at a country level? So really supporting these sort of national assessments that we've heard many of the panelists speak about today to drive action and to scale up solutions. So I believe that there's a lot of merit in obviously linking up with GCF, Rockefeller, Global Fund, and many others as well in this space. Wellcome Trust, I should not forget, because they've been driving also quite a bit of the work that we've been doing on the operational research at a country level, again, to inform country policies.
And this is my fault for giving the panelists such a meaty question in a lightning round. So just a reminder, lightning round, 20 seconds or so, Marionka, and then Dinesh.
I'll be quick. So I think GCF has a unique opportunity to lead, especially in these times. My message, use your readiness and preparatory support funding to elevate health in climate planning, and that includes disease surveillance to infrastructure mapping, support governments to develop cost-inclusive national adaptation plans where child health is not a footnote but a pillar. And secondly, beyond that, in the health sector, there has been a good level of support for the health private sector foundations, including for Save the Children, using their funds to support leveraging climate finance. However, there's much less happening through the big health funding institutions, at least in our view. So this is calling on them to channel climate finance to the health sector. And I think this is an opportunity which shouldn't be missed. Thank you.
Thanks, Marionka. Dinesh, final word to you.
Global Fund already signed an MOU at WHA last year. 3 projects coming this year with a blended financing, most likely.
Fantastic.
Depending on how the geopolitical scenario arrives. GCF, I don't know if you're aware, Martin, that of all the banks, the biggest pipeline and the financing for GCF is for ADB. And we are earmarking few projects for them in the pipeline. GCF works on project basis and not on MOU. So we'll have a very soon couple of projects coming up in the pipeline for next year for supporting us.
Terrific. So I want to ask you to join me in thanking our panelists for not only making financing fun, which hopefully we manage, but also with ADB's announcement, making it exciting.
Thank you.